our first MAiD kit, we will be focusing on what medical assistance in dying means, Canadian law, the role of nurses and other healthcare providers, and the impact on the patient and family. So let's get into it.
According to the CRNNS, medical assistance in dying refers to when a client requests that a nurse practitioner or physician prescribes and administers a medication that results in the client's death, or prescribes or provides a medication to the client so that the client may self-administer the medication and in doing so, causing their death. MAiD is the act of permitting individuals diagnosed with a terminal illness to end their life upon request in conjunction with the completion of a thorough assessment to determine eligibility.
Bill C-14 was passed in June of 2016 to better encompass the essence of MAiD. It challenged previous terminology of medical assistance in dying to physician-assisted death. Bill C-14 makes it possible for eligible persons in Canada to receive MAiD and provides safeguards for vulnerable populations as well as healthcare professionals involved. As a result of these changes to Canada's criminal code, it established a more patient-centered approach to the act of physician-assisted death.
To be eligible for MAiD, the client must be eligible for health services in Canada. The client must be 18 years of age or possess decision-making capacity. The client must be diagnosed with a terminal insufferable illness that deems their death reasonably foreseeable. An autonomous decision must be made by the client, and all other options have been discussed with the client by the healthcare provider.
Following the implementation of the Act, Canadian nurses will continue to have a significant role in providing high-quality, person-centered end-of-life care that includes physician-assisted death. In terms of advocacy, as a nurse participating in MAiD, it is essential to maintain the professional standards of practice as outlined by the CRNNS, as well as the Code of Ethics provided by the CNA. These frameworks provide nurses with an ethical lens to help guide decisions and to act as an advocate on behalf of their patients. Some nurses may feel moral distress when being involved with the MAiD process. It is important to perform self-reflection with respect to death and dying. The nurse has the right to conscientious objection, as there is nothing in the criminal code that compels nurses to aid in the provision of medical assistance in dying.
For many patients considering assisted death, the right to die with dignity is the most crucial decision that they should have to make. When providing care to the family, it is important to acknowledge the array of feelings that may come with a loved one choosing physician-assisted death. Promoting this open atmosphere to discuss death freely may help with the acceptance of the impending death. In several studies, many family members have expressed feelings of relief as they feel that their loved one will no longer be suffering, although this may not always be the case.
In conclusion, MAiD is the process in which a patient can consent to and be deemed eligible for physician-assisted death given their foreseen health status. MAiD is an option for patients who are diagnosed with a terminal and insufferable illness. Healthcare providers play a pivotal role as they advocate for their patients and provide support to them and their families. As healthcare providers, moral distress may occur throughout the MAiD process, which makes self-reflection so crucial. Additionally, MAiD has a significant impact on patient and families, which is why adopting a family-centered approach is imperative. This first MAiD kit has given healthcare providers the necessary tools to be aware of the impact, implications, advocacy roles, and surrounding legislation of MAiD.